Your doctor will frequently be suspicious that you have chronic lymphocytic leukemia by looking at the blood smear in your exam, but to confirm that requires some pathologic evaluation. In the past, we used to do Bowman's test on everybody, but frequently the diagnosis of CLL can now be confirmed by something called flow cytometry or immunophenotyping. It's looking at certain markers that are on the surface of your lymphocytes. Sometimes they're inside the lymphocytes, but largely on the surface. And it's done by just pushing a large number of cells through and looking to see what things attached to the surface of the cell. Sounds complicated, it's actually pretty straightforward, and there's a particular pattern you see with CLL, which you're usually trying to differentiate or tell the difference in that and some low-grade lymphomas. Most of the time, that's fairly straightforward from just looking at the blood. In addition, we can use similar type things to develop some prognostic indicators. The biggest prognosis depends on the stage you're at when you're diagnosed. As we talked a little bit earlier, how advanced your disease is and stage. But the major prognostic factors related to certain markers on the cell, there's something called CD38, which is a marker on the surface of cells. There's the immunoglobulin heavy chain, where it's mutated or not mutated, that makes a prognostic difference. There's something called ZAP70, and most doctors don't necessarily do ZAP70 because it's still somewhat of a research test and it's hard to get good results, but you'll read about that if you start reading about your chronic lymphocytic leukemia. One of the important clinical prognostic factors is how rapidly your disease grows. And much of this is common sense. If your disease grows rapidly, then you would imply that that's not a good prognosis, and indeed it's not. So we talk about lymphocyte doubling time. Whether your lymphocytes double in number in less than 6 months, then that's felt to be an indication for possibly need for treatment, and it's also felt to be a poor prognostic predictor if you don't receive aggressive treatment. And most of the other prognostic factors are covered by what kind of physical condition you're in yourself and what's your underlying health. But those are the main ones that help predict your outcome and also help us predict whether or not you need treatment now or whether we can watch and wait and treat later, because many patients with CLL don't need treatment now, and many of them may never need treatment until we observe them for a while at least.